All right, so good evening, everyone, to another session of follow-ups. And today we have a special session. We are going to have a live testimonial. And who better than a specialist, a super specialist who already has been into practice for a long time. And when he sees his own transformation, then, everybody else get, inspired. So we have a hepatologist today from Pune. And, he had approached me almost maybe, I think, 6 to 9 months back, and then he got started on his journey. He had a wonderful transformation, and instead of me talking about his transformation, let's talk about him directly. I'll just spotlight you, Vinit, for everybody, and I'll spotlight myself as well. All right, fine. So good. So Vinit, today I'll be asking you a few questions, and this is going to be a short discussion, and this is going to be a very
Yeah,
friendly discussion. And it's like, we just want to have a chat so that, and the reason we want to have a chat is because stories inspire a lot of people. Okay, because when you have your own story, you yourself got inspired by somebody else's story, and now it is your story, and now your story is going to inspire so many other people as well. Okay, and that's the reason that we are here. So I would recommend you to be crisp to the point, and whatever questions we are asking you, you can answer them. And we want to finish off this session in next 15 to 20 minutes. All right.
definitely. Yeah,
Good. So Vinit, can you first, introduce yourself? Can you just talk about yourself? What is your professional background? Where are you from? Can you just throw some light on that?
yeah. So, good evening, sir, and good evening, everybody. So, I am Dr. Vinit Shah. I am born and brought up in Pune. I am a trained medical gastroenterologist. Because of my love in liver, I focus on liver diseases for last 8 years. So basically, I am currently working as a senior consultant in liver diseases, liver transplantation, and gastroenterology at Ruby Hall Clinic as well as Pune Hospital. I am graduated from BJ Medical College, Pune, 2001 MBBS batch, following which I have done my medicine training in Pune Hospital and medical gastroenterology training in Sir Gangaram Hospital and Medanta in Delhi NCR. After that, I have been in practice focusing mainly on liver diseases and liver transplantation for almost last 9 to 10 years now. And I have been in Pune practicing liver diseases and liver transplantation since almost last 6 to 7 years.
That's amazing. So that's a wonderful career. And being a hepatologist, it's not easy. I know a very hectic schedule, especially, one liver transplant comes and then, your nights are fired. And especially if the case doesn't go well, then, it's an uphill battle. So I can understand. And, we all go through different phases of our, journey. And most of us are doctors here. I can see almost everybody is a doctor here. Okay. So we go through this phase, we pass out our MBBS and MS and MCH and whatever it is. Okay. Once our education is complete, then we are into this process of building our practice. And in that process of building our practice, you lose your own health in that
Yes.
transaction. Okay. So can you just elaborate a little bit more on what problems you are facing, before we got connected?
So basically, my overweight issue started from somewhere around 2011-12, the time I moved from Pune to Delhi. So Delhi is it is a capital of India, but it is also the food capital of India, I think so.
Correct.
One of the best types of food you get in Delhi. Plus, I was staying alone there, so it was devoid of home food. So that lured me into faulty eating habits. And from there, my overweight, obesity issues started. Still, my weight was okay till 2016-17, but 2018 onwards, especially post-COVID, my eating habits really became very, very irrational, which I can retrospectively tell now. Means it was like a ritual for me to have vada pav, kachi dabeli, bhel in the same order from Monday to Saturday. Plus, then Zomato and Swiggy came in a big way, and then night ko pav bhaji mangalo, dosa mangalo, eat at 10:30, 11, watch movies. So this was my lifestyle, and this really pushed me into overweight. I became almost 90 to 91 kg. So this was the major problem. But with obesity, what I realized came lot of other things like really very poor energy levels, reduced work efficiency, lot of anger issues, lot of personal issues with family members. And all this really made me go into a cycle of overweight, faulty eating habits, again, all these negative impacts. And this cycle I was just not able to break.
Absolutely. And Vineet, can you just touch base upon, let's say, if you would not have worked on your health, what do you think, what consequences you would have to otherwise face in next 5 to 10 years down the line?
So here I would lay stress upon some important aspects of my family history because I think so it's very relevant to the discussion here. So my father also suffered from liver cirrhosis. He had obesity. He had non-alcoholic liver disease which progressed to liver cirrhosis to the extent that he required a liver transplantation in 2017. It was a big eye opener for me, but still, as you tell in Marathi, सोनाराने कान टोचावे लागते. Still, somehow that did not change my behavior. After that, unfortunately, he met with a very crippling stroke, again related to a complication of obesity and dyslipidemia, to the extent that he became bedridden. So that was the eye opener. My real uncle also had liver cirrhosis because of the same etiology, and there was a demise of him because of that. So all these three were very big eye openers for me. To add to that, in my day-to-day practice, the predominant practice is seeing sick liver cirrhosis patients, patients in liver ICU on ventilator. Many of them even don't make it to transplant. Those who require transplant, their quality of life after transplant, and to add to that, the sacrifices and the financial expenditure their family has to go. So all this was really a big impact on me. But as I told you, that cycle was not getting broken. Even though I was realizing that I have to work on my health, and if I don't do that in next 5 10 years, maybe I will also head in the same direction as to the patients I see in my day-to-day life. So
Absolutely.
that
And
is it.
being a hepatologist, I will, this is a little off track discussion, but this becomes relevant here because you being a hepatologist. Now, you talked about two patients in your own family who landed up with cirrhosis, and this was non-alcoholic. Okay.
Non-alcohol,
Yeah,
yes.
when I was doing my MS, if anybody is coming with cirrhosis, at that time we used to think that probably he
Alcohol
drinks a lot
unless proven otherwise.
unless
Yes,
frozen
yes.
over. So can you tell me your experience, like in your practice now, how much percentage of patients do you feel that who are coming in cirrhosis or probably stage 3 of fatty liver, in your practice? What is the percentage?
So basically, you can tell now, like we told, there was a pandemic of corona. There is a pandemic of obesity. And the most important complication of obesity, which we are seeing in our liver practice, is non-alcoholic fatty liver disease. To the extent now it is renamed as metabolic dysfunction associated steatotic liver disease. It is no longer called non-alcoholic because the metabolic syndrome is such an important component of this. So it is now more called a metabolic dysfunction associated steatotic liver disease. It is one of the most common causes of liver disease. In US, it has become one of the number one indications of liver cancer and liver transplantation. Earlier, it was hepatitis C virus, but in next 1 or 2 years, it is projected to become the number one indication. Also, we have done some study in Gangaram Hospital where it is the second most common cause of liver cirrhosis in India. It has overtaken hepatitis B and hepatitis C virus. Though alcohol remains the number one cause in India and Maharashtra, but still non-alcoholic or metabolic syndrome or metabolic dysfunction associated liver disease remains the one of the top causes of liver cirrhosis and liver cancer in our part of the country as well.
Absolutely. And then, there can be a double combo offer as well. Somebody who is obese and drinking as well, then it's a double combo offer which takes a toll on
Yeah.
you. Correct. So great. So
Then
I'm
it
sure,
is
yeah.
then
Go
it
ahead.
is आग में घी डालना.
Correct,
Yeah.
correct. So
Yes.
good. So, Vinit, I'm sure we got connected 6 to 9 months back, and you had been having this problem since 2016. Is that correct, Vinit? That is what you said, correct?
Yeah. So it got really worsened after 2018-19.
Right. So, I'm sure you had tried certain things, before we got connected. So can you just elaborate a little bit more on the things which you had tried before? How was the result? What problems did you face during that time? Can you just elaborate a little bit more on that?
So the most initial thing which I tried was to eat only fruits in the night. Second I tried was really increasing the fasting, just eating 2 times in a day. Third thing I tried that time, this Dikshit diet was quite in vogue. So I tried that because in 2018-19 that was the in thing. I also tried calorie deficit, so eating less. So these were some of the things I tried. One of the problem I faced was that I could not maintain it for more than a month or 2 months. And the relapse which used to occur after that was even worse with worse food cravings than before. So these were the problems and these were the efforts. I had frankly not consulted any wellness person or any health coach because means as doctors you have the ego that अपने को सब कुछ आता है and अपने को किसकी क्या जरूरत है ऐसे coaches की.
Correct.
So that ego even I was having. So I had not consulted anyone, but on my own way I was trying all these things.
Absolutely. And to be frank, when I started my own journey way back in 2015, I had a similar intention. I was almost 15 kgs overweight, but I was not having any other problems. I had no hypertension, no diabetes. So my intention was, I'm fine. मेरे को कुछ हुआ नहीं है, ठीक है. I don't have diabetic blood pressure, so I'm fine. Okay. So that was my intention. It was only when my body fat composition was done, I realized that I am overaged by 10 years. That is when, I started working on my health. So there has to be some trigger. And probably you had a very, very strong trigger factor in your own family with your father is
Yes.
suffering from that. That was a big major trigger. Okay. So good. So you tried certain things and they did not work. And probably the programs which you tried were non-sustainable. Is that correct, Vinit?
Yeah, maybe the methodology was non-sustainable or something like that.
Correct.
Yeah,
See, basically, the only question that we ask, okay, in any program is that if you can sustain that program lifelong, then it's a sustainable program. If you can't sustain it lifelong, then obviously it's a non-sustainable program. Okay.
exactly.
So
Exactly.
good. So we started working about 6, 9 months back. So can you tell me what did you like in the program? Maybe few specific things you can just throw some light on.
So the most important thing was that you being a doctor, understand the pain of a doctor. You understand their lifestyle. You yourself being a very good pediatric surgeon, know that the irregular working hours, irregular meal timings. So I could relate to you. The other good thing was you really gave in-depth time about understanding all the small, small things, which very few people do. And after that, the program which you made to me was tailor-made program for my daily activities. It was not like ऐसा ही करना पड़ेगा नहीं तो नहीं होगा, यही करना पड़ेगा नहीं तो नहीं होगा. I also faced that सर ये नहीं हो सकता है, but you are always ready with a solution. अच्छा ये नहीं ना तो ये करो, ये नहीं करना है तो ये करो. So it became more and more practical for me and it became more and more sustainable. The
Correct.
other thing was the personalized approach, that calorie charting, food collage, it really makes you eat really mindfully. Before that, you don't eat mindfully. But once you know कि इसमें इतना calories होता है, and you keep on charting that over a period of time, you know कि यार ये item से इतना problem आने वाला है. So it has really made me very mindful about what I eat. So this was the good additional point about the program. Third thing was that everybody feels diet and exercise is everything in weight loss. What you introduced were the other important pillars, like how sleep is important. The most important thing which we doctors, I'm sure, very few practice is mindfulness and mind relaxation. That was a very important pillar on which you laid stress. Changing the home environment was the very important thing. So how can we improve by improving the cookware? How can we improve by reducing the cooking oil consumption? So all these things really make the program very personalized, very sustainable, and I will tell you, any problem in life you face, you are always available. Means there are many problems which you cannot discuss in public forums, but you are always there that Vinit, you call me, we will sort it out. So I don't think so. That approach you get in the so-called wellness center. So that personalized approach was the thing which I could relate the most, and it has significantly helped me in my transformation.
That is wonderful. A few things which I would like to talk about because this is a struggle of a lot of doctors, and probably when this video will go on social platforms, this will be very important for them. So I still remember, Vineet, that you used to have your lunch at somewhere around 3-4 o'clock and dinner somewhere
Yes,
around 10-11 o'clock. Is that correct?
yes,
So
yes,
how you were able to switch that? Because right now I think you are having your dinner at around 7 o'clock, correct? And
yes, 7,
lunch,
7:30.
right, and
Lunch
11.
by 1 o'clock, 2 o'clock.
So
Yeah.
how you were able to make this switch?
So one was your motivation. And then I realized, boss, अपने को तो ये करना है. So patients may come, patients may go. Those patients who really need you and who really want to show you will anyways wait. So your health is important. The onus of your health is on yourself. Doing one endoscopy less, seeing 4 5 patients less is really not going to matter in the long term, because ultimately with good health your efficiency will be top notch and you will be able to see 5 times more patients, you will be able to do 5 times more procedures. So that belief which you brought in me really helped me change my approach, and now I really make it very simple communication to the patient that between 1 or 2 o'clock I have my lunch. So means if it is possible for you to wait, wait. Otherwise, we can see tomorrow, or you come in this time. Similarly, in the evening, I just switch off my phone between 7 o'clock to 8 o'clock. So I think so. These radical changes a doctor has to make, and I think so. All patients start understanding and they start respecting you, and they means कुछ फर्क नहीं पड़ता है long term में.
Correct. So basically, Vinith, see, previously, feel probably the patient was dictating your time. Okay.
Yes.
And later on, you took the control of your time in your own hands. Now, you tell me, by changing, doing this switch, did it affect your practice? ऐसा हुआ क्या कि मेरा प्रैक्टिस अभी कम हो गया, पेशेंट्स दूसरे के पास जाने लगे, ऐसा कुछ हुआ क्या?
Nothing like that happens. I think so. It is just in the mind that you feel insecure seeing your peers. अरे ये तो खाना ही नहीं खाता है, ये दोपहर को भी इतनी प्रोसीजर्स करता है, दोपहर को भी इतनी केसेस करता है, कंटिन्यूअसली इतनी घंटे ओपीडी निकालता है. It is just in the mind. I think so. If you set your priorities right, same number of patients come, and in fact it will be better, because with a better health you will work more efficiently, and your better health makes such a positive impact on the patient that more and more patients get that feel good factor that ये डॉक्टर भी फिट है तो इसका एडवाइस शुड बी रियली रेलिवेंट. सो
Absolutely. Tell
या.
me a little bit more on this, Vinith, because see, I'm sure how much is the percentage of patients who are coming to you are in obese category?
So I, being a hepatologist, one of the major domains of my practice is fatty liver. And as I told you now, the term non-alcoholic is replaced by metabolic dysfunction associated liver disease. So obesity is a very crucial component of metabolic syndrome. So at least 70 to 80% patients who come to us with fatty liver are obese or overweight or having dyslipidemia, diabetes. So it is a very significant chunk of patients. And
Absolutely. So, yeah, go ahead.
once they see your weight loss, means there are patients who are on 4 monthly, 6 monthly follow-up. So they first thing they tell is, यार सर आप तो अलग ही लग रहे हो, आप यंग लग रहे हो, आप पहचान में ही नहीं आ रहे हो. So then the advice which you give them about lifestyle modification has a deeper impact on them, rather than you just talking the mundane things कि weight loss करना पड़ेगा, ये करना पड़ेगा. If you yourself are obese and you are talking this, but you are not practicing what you are preaching, I think so the impact is less than the impact you have by talking after achieving a transformation.
Absolutely, absolutely. And this is a very, very strong message to the fellow doctors that if we don't keep our own health, okay, properly, then how your patients are going to believe you and on what basis are they going to believe you? All right. So that makes a lot of sense. So Vinith, can you just throw some light on what things have transformed in your health? We had been talking about transformation, but just let's talk about what all things, can you just tell us what all things have changed since the time you got started in last 6 to 9 months?
So the simple answer to that is I have transformed as a better human being in all this. Better human being in terms of very good physical health, very good mental health. Then these accessory things are always going to be there. So I have lost around 14 to 15 kgs. I have lost around 14 to 15 centimeters of waist circumference. My energy levels are very good. My mood swings are very good. My anger issues have significantly improved at my workplace. Earlier, sister से थोड़ा भी गलती हो गया, it would be like, अरे डॉक्टर विनीत के पेशेंट में गलती हो गया तो it is a terror. But now the way with which I deal things has changed. And the other important thing which has happened is food craving at night was a very important thing which I was really not able to overcome. So Dr. Prashant gave me a very good advice ki 20 minutes you play with your son after you come from home. So night I started playing cricket with him for almost and that time luckily World Cup also happened. So my son really became fascinated with cricket around October, November. And that has indirectly improved my bonding with my son. It has become a very good stress buster for me. My sleep has really improved. So there are multitude of benefits, but this transformation really changes you as a human being. And the other things are the benefits which are naturally going to be there once you transform as a better person.
Absolutely. And this is a very important thing, Vineet, which you touch based upon, is that we doctors are so much engaged in our practice that we forget about our personal life and we forget that there is a family behind us as well. Okay. And if you ask a question, कि ये सब क्यों कर रहे हो? They say that, I'm doing it for my family. And then you're always away from your family. Then what's the point of doing all that? So striking a work-life balance, okay, is so very, important. So great, did you ever feel, Vineet, while doing this program that it is very difficult to follow and this is something which, we cannot sustain lifelong?
So maybe initially that evening meal to be completed by 7:30 was a big challenge for me. But I think so the way you guided that you can concentrate more on fiber and good fat in the night. Your idea about green tea, your idea about apple cider vinegar, then I think so it became just a more psychological thing that I wanted to put something in my mouth. It was not true hunger. Then your this idea of playing with my son in the night. So these all things really helped me. And after I think so 3 months, it became a very sustainable, easy thing. And now I really don't feel it to be at all difficult to be made it as my daily life practice for my entire life.
Awesome. So that was a wonderful discussion, Vineet. Do you have any message for all the people here and probably when the video will go on social media? Do you have any message for maybe the doctors also and for other people also? What would you like to say?
So my really strong message would be for doctors is really invest in health. Means it is time that we doctors invest in health. Every effort towards our good health is going to give reaping benefits in the next future. And definitely investing in health is the most important priority, one of the most important priority which doctors should do. Personalized programs which understand your life situation, which understand your working are the need of the hour. And I think so Dr. Prashant is one of the best persons I feel you can get to offer this personalized kind of help and really make you excel in life and transform yourself.
All right, thank you very much. Well, I don't take the credit. The credit goes to Vineet because similar kind of advices I give to so many people. But it's the person who follows gets the results. Okay. So Vineet, thank you very much for coming on this platform. I know you have a very busy, hectic schedules, but still you took out time from your busy schedule to come here. And thank you very much for inspiring a lot of people here. Have a good night.
Yeah, my pleasure, sir. My pleasure.
Bye.